Thanks so much for inviting me to speak today, Ingrid. So I'm a speech pathologist, and for those of you who might not be familiar with what speech pathologists do, we're interested in studying and diagnosing and treating communication disorders and also swallowing disorders. And today I'm just going to speak about one type of communication disorder, and that's speech disorder. So what I'm meaning is how you produce or articulate speech sounds. So individuals who have epileptic encephalopathies have a wide range of speech skills, and even individuals who have mutations in the same gene will have a range of different speech skills. So we have individuals who don't have speech to individuals who can have a conversation. Individuals with epileptic encephalopathies have a number of different motor impairments as well as social, communication and cognitive challenges that can impact on their speech. Ingrid showed some nice videos before of some individuals who had movement disorders. Individuals can also have oral motor impairment, so that's how they move their articulators, so their lips and their tongue and their jaw, that can be affected. They might have high or low muscle tone, so that is talking about the tension in the muscles. So they might their muscles might have too much tension in their muscles or not enough tension in their muscles. They might have difficulty coordinating movements, and also some individuals might have difficulty with maintaining their posture, so they have a slumped posture or tilted head. So these this is a little video of a young lady or a young woman who's got Dravet syndrome, and this is just to illustrate what oral motor impairment looks like. So I've asked her to do a task where she says ooh-ee, 10 times, and if you just have a look at her lip movement, it's slow and reduced, and there's a bit of asymmetry with her lip movement as well. That's it. Beautiful. So you can also see she's having a lot of trouble maintaining her posture, so she's quite slumped as well. So these motor impairments can impact on speech, so as well as affecting movement in your whole body, it can affect the movement of your muscles for speech, and this can lead to a speech disorder that's called dysarthria, and many individuals with epileptic encephalopathies have this speech disorder dysarthria, and this can affect the range, rate, strength and coordination of the muscles for speech. So in dysarthria, you can have impairment at one or more levels of the speech system. So you can have impairments in resonance, so that is how the air is shaped as it passes through the mouth and the nose. So individuals with dysarthria can have too much air coming through the nose, so they sound a bit like this. They can have difficulties with articulation, so that's how you produce speech sounds. So you may have sounds that sound slurry or distorted, or sounds are missing or substituted. Phonation is how you make voice at the level of your voice box. So individuals with dysarthria might have difficulty with the volume of their voice, or they might have a scratchy sounding voice or a hoarse voice. Respiration is your breathing, so individuals with dysarthria often have difficulties with breath support for speech, so they'll run out of breath. When they're speaking, they'll have shortened phrases. And then prosody is this rise and fall of speech, so individuals with dysarthria can sound monotonous or a bit robotic. So this is a little boy, he's 10 years old, and his speech is moderately impaired. So if you just listen for how he articulates some sounds, so some sounds are a bit distorted, he's missing some sounds. The pitch of his voice suddenly goes up sometimes, and he also has these rushes of speech.
Mommy! Mummy, is it autumn today?
Do you remember what it is today? It's not autumn.
What's
it's
this?
Winter.
Winter.
Yeah.
What's that? It's winter here.
Yeah, it's winter here today, isn't it? We're wearing our jumpers.
Jumpers.
Is it raining today?
Yes.
So the way that we treat dysarthria is to target breath support for speech. So respiration is what drives the rest of the speech system. So you want to use different strategies to help to control breathing, and that will then support speech across a phrase or a sentence. And the aim is to improve intelligibility. So that's how understandable an individual's speech is. And there's different ways that we do this. In the past, they used to use some approaches like blowing horns or windmills, sucking drinks through straws, or licking food. So these non-speech approaches, and there's really very little evidence that these approaches that aren't working on speech directly actually help speech at all, and so they're not really recommended. So I've just got here some of the strategies that we might try with individuals who have dysarthria. So it could be that we ask them to sit up nice and straight, take a big breath before they speak, and then to use a big, strong voice when they're speaking. So individuals with epileptic encephalopathies also often might not have speech. But they can use non-symbolic forms of communication. So I've got a little video here of a young girl, again with Dravet syndrome, and she's got some non-symbolic communication. So we're playing with some musical instruments, she touches my face and she vocalises.
The music. The music.
Okay, so other forms of non-symbolic communication could be gestures, eye contact, giving an object. So often children might give a container that might have food in it to ask their parents to open it. They might take their parent's hand, put it on a door to ask that the door to be opened, and different types of vocalisations. So in these individuals, we would look at introducing alternative and augmentative forms of communication. So these are a way of communicating for individuals who have very limited speech abilities, but can also be used for individuals as a backup who do have speech, but their speech is very difficult to understand. And they can also be used to help when individuals have cognitive challenges or language delays, to help them to understand and to develop language. So there's different types of systems. There's unaided systems, and these don't require equipment. And I've seen many parents, I think, would be familiar with some keyword signs like finished and toilet. And there's also aided systems, so these can be high technology systems or low technology systems. So low-tech systems would be things like picture cards or visual displays, and they have photos or pictures or words to represent tasks, actions or objects. And then high-tech systems are things like speech-generating devices, little computers or iPads, electronic devices. So I've just got some examples of the range of different AAC devices that could be used. So here I've got some object symbols. So these are objects that represent activities or events that can be used to help the individual understand what's going to happen and make simple requests, up to a high-tech device, so an iPad that could have lots of different symbols on it and then have voice output. There's also some community request cards. They're really nice for individuals out in the community. They can use these to be able to request items or services. Okay, so there's a bit of a misconception that introducing AAC is going to hinder speech, but actually the opposite is true, with research suggesting that it actually facilitates spoken communication. So for individuals who have the potential for speech, that AAC is actually not going to stop them from speaking. It increases interaction, it helps to develop language skills, and it also provides a voice output model for speech. These systems can be quite complicated often, so needs specialist support in terms of designing what's going to be most appropriate for your child. So often speech pathologists will get advice, or you as parents can get specialist advice from particular services. I've got two really great services here, that's Scope or Comtech. You might have had some contact with them already. They offer some advice and support about different AAC systems. They've got resources online and information if you wanted to go and have a look. So if you were thinking that you wanted to review the AA system that you might have in place, or get a bit more information, or that would be a good venue to go to. I think that's me. So I'm happy to answer any questions now, or maybe during the break, because I think it's morning tea time now. So thanks very much.
That was spot on. Thank you, Sam. We'll take one or two questions.
And she typically is sucking in, so when she's talking she goes like this. Also, she gets very confused with her, she might be telling a story and it goes from story to story and very confusing. Is that something that a speech therapist or pathologist, sorry if I get that wrong, I should be taking her to and talking to them about that?
Yeah, so it sounds like maybe she's got some issues with her breath support for speech, but also her language skills, and certainly a speech pathologist could do an assessment and give you some information about some ideas and strategies and therapies that could help her.
Because I think it's becoming a habit more than, we're trying to bring it to her attention. She knows she's doing it.
Right.
But, yeah.
Oh, the sucking in?
Yes, definitely.
Right.
Might let you talk about that further, sorry, at morning tea. We might finish up there. Thank you very much. Sam's coming back for the Dravet families with her specific work on Dravet. Thank you very much, Sam.